Hello, my name is Cheryl Bartles, and I am a veterinary nurse that works in the dentistry and oromaxillofacial surgery department here at the UW Veterinary Care Hospital. Today I'm going to demonstrate how to perform an efficient and comprehensive oral examination on dogs. The authors do not have any conflicts of interest to disclose. There are many reasons why you should perform an oral exam on every patient you evaluate. Oral health plays a big role in the overall health of our patients, and periodontal disease is one of the most common diseases affecting our pet population. The first point that I'm going to emphasize is that it is always important to wear gloves when you are touching the mucous membranes of your patients. This is both for your protection and hygiene as well as theirs. Now that you are geared up to examine your patient, the first thing to do is step back and observe the head. Take notice of their muscles of mastication, facial symmetry, the coloring of their nasal planum, and if there are any obvious lesions or draining tracts. This can be done while you are obtaining a good history on your patient. When you begin to examine the dog, you should always start by moving slowly, as many animals are hesitant to having their face and mouth examined. Start by running your hands over their face and neck as if you are petting them. You are feeling for any masses or lesions that may be hidden under the fur. Try to be systematic. The extraoral exam should always include the ears, eyes, zygomatic arch, both the temporal and masseter muscles, as well as the sagittal crest. The lips and nose should be evaluated for any crusting or ulcerative lesions that may be present. Finally, palpation of the mandibular and sublingual salivary glands and the mandibular lymph nodes should be performed. To check the lymph node enlargement, locate the mandibular salivary glands first. The salivary glands are typically plump, oval, and soft. They will be encapsulated structures just caudal to the angle of the mandible. In a large breed patient, they should be the size of a ping pong ball. Once you have found the mandibular salivary glands, the mandibular lymph nodes will be immediately rostral and medial. They should be small, soft, and unattached, approximately the size of a bean. Now we're ready to move to the inside of the mouth. Start on one side of the face by lifting the lip with the mouth closed to evaluate the occlusion of the canine and incisor teeth. In a normal occlusion, the maxillary incisors sit just rostral to the mandibular incisors. This is known as a scissor bite. Note that in this patient, the maxillary incisors meet edge to edge with the lower incisors, without the upper incisors overlapping the lower incisors. This is known as a level bite and may cause attrition or abnormal wear of the teeth due to abnormal tooth-to-tooth contact. This may result in formation of tertiary dentin or pulp exposure. It is recommended to have this evaluated under general anesthesia by means of dental radiographs and dental charting to determine the best treatment plan for these teeth. The mandibular canine tooth should sit centered between the maxillary third incisor and the maxillary canine tooth without them touching. Next, you can move to the caudal buccal cavity again, lifting the lips back to evaluate the teeth. The tips of the mandibular premolars should fit into the interdental space of the maxillary premolars, with each mandibular premolar mesial to the corresponding maxillary tooth, forming a zigzag pattern. Finally, when evaluating occlusion, the maxillary fourth premolar tooth should be on the buccal aspect of the mandibular first molar, and the maxillary first molar tooth should occlude with the flat occlusal surface on the distal part of the mandibular first molar. This is also a good time to take note if there are any fractured teeth as well as any missing teeth, such as the mandibular fourth premolar tooth in this patient, depicted with the yellow star. We also want to note any rotated teeth or teeth that have any wear from abnormal attrition or abrasion. Remember to allow your patient breaks while you are performing an oral exam. It's also important to evaluate the patient for any side-to-side head asymmetry. After performing the examination on the first side, repeat the same evaluation of the other side of the mouth.